All right, you've got your study plan, so what do you want to start with? Well, the very first thing you want to do is go take your baseline learning assessment. So you're going to go to your Archer Review dashboard and you're going to click the Q bank. When you're here, click on Create Test, and you're going to get this pop-up that says Archer Review Baseline Assessment, and you're going to want to click Start Now. Now, when you start this test, what's going to happen is when it loads, you are going to get a test. When you're done, it's going to give you a mock candidate performance report. It's going to give you the same amount of time that the NCLEX would give you, which is up to 5 hours. Now, let's go ahead and look at what you would do after you've taken your baseline learning assessment. So the next thing you would do is go create test. And once you're here, you're going to see several different options for creating a test. The first is CAT or adaptive testing. This is going to give you anywhere from 85 to 150 questions. We recommend you take CAT exams to get you used to how the NCLEX is going to adapt to you. Then there's tutorial mode questions. This is what you're going to use most of the time. In tutorial mode, you are going to be able to pick your different client need areas or subject or system, as well as specify which topic you want to focus on. You can choose to have this timed or untimed. Timed gets you used to how the NCLEX is going to give you 5 hours for up to 150 questions. You want to keep each question to about 2 minutes. If some go a little over or some are under, that is totally okay. And then lastly, we have our readiness assessments. This is one of the most important tests that you can take here at Archer Review. The goal is at least 4 highs or very highs consecutively before you go take your NCLEX. Now, if you do that, your first 4 readiness assessments, don't stop there. I also recommend you get at least 80% through our Q bank. Now, for CAT exams or readiness assessments, it's just going to start the test. You're not going to be able to pick the types of questions you want. But in the tutorial mode, you're going to be able to pick which question types you want. So there's classic. This is going to be those traditional items. About 75 to 80% of your NCLEX will be these traditional or classic item types. Question A, B, C, D. Then you're going to have your NGN items. When we look at your NGN items, you're going to be able to choose SATA, unfolding NGN case studies, or standalone NGN cases. Now, what you're going to notice is that you can only use up to 60% of those items in tutorial mode. 40% of those items will be saved for CAT exams and readiness assessments only. Now, on the average day, you're going to want to go ahead and choose mixed, and then you're going to want to use your unused from all. That's how you're going to take most questions. Now, you can choose the test length. You can choose to do 5 questions. You could choose to do 150 questions. I do recommend at least twice in your studying, do a 150 question test to give yourself 5 hours. Get yourself used to what a full length exam feels like. It does take a lot of stamina to get through 150 questions. It's just a bit exhausting, and I want to make sure you're ready just in case you get that full test. Now, if you wrote down a QID and you're like, oh, I want to make sure that I go review that QID again, if you go to custom, you can type in any QID to find that exact item. Any question that you mark will show up here. Let's say you marked it for review later and flagged it. You'll be able to filter those here. And then omitted is if you accidentally didn't submit a question. It will go into the omitted column. Make sure you answer all of these omitted questions before you go take your NCLEX. So let's say we were going to take a tutorial mode test. Then I would go ahead, click mixed, subject or system, or you could do it by client need areas if you prefer that. And then I'm going to go ahead and click unused. Then once I'm here, I can choose from the different subjects. On the average day, I want to select all and select all the lessons. But let's say you wanted to focus on just endocrine. You could deselect and just focus on endocrine. Now, if you are going to just focus on one topic, I recommend just doing about 25 questions in that content area. The reason why is you want diverse questions to be showing up in your readiness assessments and your CAT exams. So if I go answer all of the endocrine questions today, well, I'm not going to have any left on my readiness assessments and on my CATs. And then once we've selected the topics we want to cover, we'll just click Create Test. And once you're here, you can see that your task will be created. It's going to tell you how many items it is, and it's going to tell me how much time I have based on what I set. Now, I don't want you to make a habit of this, but let's say you need to pause your test. You can just click here, click pause. Or if you're like, oh, I didn't mean to start this test, you could end it. But I actually don't recommend this. I would pause it here because otherwise all 85 of these questions are going to go into the omitted category. So we're going to go ahead, we're just going to pause this test. Now, what you're going to see is this is going to go ahead and it will show any missed questions here in your remediation. So in the next little video, I will show you how the remediation is going to work, because this is really going to ensure that you're strengthening your weak areas. After you take a test, this is what's going to pop up. You'll see your score report, how most people do, as well as see the different items down here as well. You can see what you answered, what ones you marked, and if any questions were omitted. Now, what I really like here is the statistics. It's going to tell you if you changed your answer. So here, I didn't change my answer at all, but it will tell you if you changed them from right to wrong to right, or wrong to wrong. Now, I highly recommend you get to where you're not changing your answers, because you want to be able to trust your testing instinct on exam day, and I want you to get used to being able to do that. And so I recommend trying to not change your answers, and if you miss it, use that as a learning opportunity to really get that information down. You can see this by different lessons, the client needs, as well as the different topics. Now, here's the part that's really important, your remediation. So when you get to remediation, it's going to show you different videos that are associated with what I just missed. So you could go ahead and you could watch these. You're also going to notice that there's the slides as well as worksheets attached there as well. And then I'm going to get to where I am going to do some remediation questions after I've watched these videos. So I could go ahead and click review. So I've watched the video, and now it's going to go ahead and it's going to show it to me again. But can I make sense of this? Does it make sense to me that post-op, I'm concerned about foul smelling drainage, nausea after pain medication, and purulent wound drainage? Well, that's what I selected, but let's review the answer. Oh, the nausea after pain medicine, that made sense. So I shouldn't have chose that answer. What I should be concerned about is the oral temperature. Well, why is that? 100.4, we're starting to see that it's getting elevated. And so I want to be able to make sure that I can pick that out, as well as that purulent wound drainage. So now that I have that down, I could either move this to a low confidence or a high confidence. So I kind of missed that I wasn't supposed to choose the nausea after pain medication. So I'm going to go ahead and mark this as low confidence because I still didn't understand it. So now I'm going to go review my low confidence topics. Now, when I go through, can I make sense of it that, oh, the nausea after pain medicine, right? That was wrong. Well, why was it wrong? Because that's an expected finding. But what's not is an elevated oral temperature. I should have chosen that instead, because that is the indicator that there could be a post-op infection, as well as that purulent wound drainage. So now that I do it and I review the answer, oh, I got it right. I understood the rationale. So now I'm going to move it to high confidence. Now, once I'm in high confidence, what's going to happen is it's going to ask me to review one more time, review the answer, and we've got it from the high confidence. Now, what you're going to see is if we go to remediation here, we're going to do a practice test, and we're going to create a practice test. When we create this test, it's going to ask me to re-answer this question. So I know that it's D, F, and G. And did I understand the why? If I just memorize that these were the answers, that's not helpful. You have to understand the why. Now that I have that, I'm going to click next, end the test. Yep, end the test, and view the result. We got it correct. Now what we're going to see is if I were to go back to the remediation, that information is going to drop off my remediation plan. Make sure you remediate at least once a week, if not more often.